Hi guys, we'll be attempting pharmacology related MCQs from the question banks of USMLE, NBDE Part 2, INBDE, NEET MDS, and more. If you're planning to write any of the dental and medical competitive examinations, this video will prove to be useful to you. Today, we will go through questions pertaining to antibacterial agents. Which of the following is a third-generation cephalosporin? Is it A. Cefpoperazone, B. Cefuroxime, C. Cefoxitin, or D. Cefadroxil? The correct answer is A. Cefpoperazone. Now, cefuroxime and cefoxitin belong to the second generation, while cefadroxil belongs to first generation. Which tetracycline drug is safe for use in patients with renal insufficiency? Is it minocycline, dimaclocycline, doxycycline, or methacycline? The correct answer is C. Doxycycline. Doxycycline is excreted mainly in the feces via bile and undergoes enterohepatic cycling. Hence, it does not affect the kidneys. Which of the following is safe to be used in lactating mothers? Is it ampicillin, erythromycin, chloramphenicol, or ciprofloxacin? The correct answer is B. Erythromycin. Because of the low levels of erythromycin in breast milk and safe administration directly to infants, it is acceptable in nursing mothers. The small amounts in milk are unlikely to cause adverse effects in infants. Ampicillin may cause diarrhea or an allergic response in infants. Chloramphenicol is found in high levels in breast milk. Ciprofloxacin 2 is generally avoided in nursing mothers. Herxheimer reaction is generally seen in the case of A. Penicillin used in actinomycosis, B. Penicillin used in syphilis, C. Cephalexin used in syphilis, or D. Amoxicillin used in injection. The correct answer is B. Penicillin used in syphilis. Also known as the Herx reaction or Jarisch-Herxheimer reaction, it's an adverse response to toxins released by bacteria when the patient is administered penicillin for a syphilis infection. It usually manifests in about 1 to 3 hours after the first dose of antibiotics as fever, chills, rigor, hypotension, headache, tachycardia, hyperventilation, vasodilation, flushing, and exacerbation of skin lesions. Tetracycline acts on which of the following? 30S ribosomes, 50S ribosomes, cell membrane, initiating DNA gyrase. The correct answer is A. 30S ribosomes. Tetracyclines are bacteriostatic broad-spectrum antibiotics that reversibly bind to 30S ribosomal subunits, thereby inhibiting bacterial protein synthesis. In patients with allergy to sulfonamides, which of the following medication is contraindicated? Is it levobunolol, bimatroprost, brinzolamide, or brimonidine? All these options are used to treat glaucoma. If you're unsure what answer to select, look at the drugs which sound similar to sulfonamide. It's C. Brinzolamide. Both are carbonic anhydrase inhibitors and therefore should be avoided if the patient is allergic to any one of these. Levobunolol is a beta blocker, bimatroprost is a prostaglandin analog, and brimonidine is an alpha agonist. Again, all of these options here are used for glaucoma. A diabetic patient developed cellulitis due to Staphylococcus aureus, which was found to be methicillin resistant on the antibiotic sensitivity test. All of the following antibiotics will be appropriate except vancomycin, imipenem, teicoplanin, or linezolid. The correct answer is imipenem. Now, imipenem is a carbapenem and does not have bactericidal action against MRSA, but has a broad antibacterial spectrum covering both gram-positive and gram-negative bacteria. Penicillin exerts its effect on bacteria by interfering with cellular respiration, cellular oxidation, cell wall synthesis, or cellular division. The correct answer is C, cell wall synthesis. Now, bacteria have a cell wall which is formed with the help of an enzyme called transpeptidase or penicillin binding protein, PBP. Penicillin blocks this enzyme, transpeptidase, and inhibits the formation of the cell wall, thus exhibiting its cidal effect. This mechanism is more effective for gram-positive bacteria than gram-negative, as the latter have an outer liposaccharide layer. Penicillin G is therapeutically used for all of the following except bacterial meningitis, syphilis, rickettsial infection, anthrax. The correct answer is C, rickettsial infection. Now for rickettsia, tetracyclines are the first choice of drug. Doxycycline is given orally for 5 to 7 days. The most common antibiotic-related diarrhea is due to H. pylori, C. difficile, K. pneumoniae, or Shigella. The correct answer is B. Clostridium difficile. A primary risk factor for C. difficile colitis is previous exposure to antibiotics, as antibiotics may alter the normal gut flora which keeps C. difficile in check. C. difficile can quickly grow out of control in the absence of the normal gut flora. The most commonly implicated agents include cephalosporins, fluoroquinolones, ampicillin, and clindamycin. Alright guys, hope you found this video helpful. If you did, show us some love and press the subscribe button and hit the bell icon to stay updated with our latest videos. All the best to you for your exams.